Okay guys, so the next part or next stage of our home corrective exercise program for low back, hip and knee pain, that lumbopelvic dysfunction, lumbopelvic hip complex dysfunction rather. What we're going to do is, now that we've done our release techniques, we've done our mobilization techniques, we've done our lengthening techniques, now we're going to get in and do our activation techniques. Okay, so it has to follow that order. Okay, we can't do activation then lengthening, that doesn't make sense. So once we've got those overactive muscles and overactive synergist muscles, which I was talking about earlier, to calm down, we've done our mobility, open up that joint space, we've lengthened those muscles, got them back to optimal length, so they're not in that shortened position anymore. Now those other muscles that have been assessed as being pulled along and underactive, now if you've got knees bow in, knees bow out, it's going to be those glute muscles that they're the big one. That's mainly what we're going after. And we're also going to do some core or deep core activation as well, because especially if we've got that anterior pelvic tilt, that really shuts down our deep core stabilizers, all the muscles that play that very important role of stabilizing that lower back, that lumbar spine. Okay, so this is where this comes in. So we're really kind of going after your glutes and your core in this part. Okay, so what I'm going to need you guys to do these techniques, okay, you're going to need these fit loops or resistance bands. Okay, they all come in various strengths. Okay, I'd start with a light to moderate one first, and then just get the technique right, and then we can go on from there. Okay, so we're going to mainly get for our glute medius, our gluteus medius. Okay, first, but we are going to hit some glute max in this first one. But this is what we're kind of getting glute medius first with this. So, and this is going to be our clamshell exercise, or our clams. And what you guys are going to do, you're going to get your band, you're going to put your feet through it, and you're going to pull that band to just above your knees. Okay, right, so just up in that position. So once they're up there, what I want you guys to do is you're going to go back against the wall. Okay, so you can do it off the wall, this one. I just find it's better against the wall because it stops your pelvis from shifting around. Okay, so ideally back against the wall. And what you guys are going to notice, I've only got my hips bent to about 60 degrees roughly, so they're not right up here at 90 degrees. That would actually favor my TFL, okay, which I don't want. I want that to shut down. The problem is that my TFL and my gluteus medius, they're both hip abductors, so they both bring my leg away from my body. But I need just pure glute medius. So if I go to about 60 degrees, that helps to shut that down a bit. It also helps to shut down my piriformis as well, because my piriformis is also an external rotator, which is turning that femur out. Okay, so I can shut that down. To really kind of shut down the TFL, what I'm going to do is I'm actually going to put because it turns my lower leg outward, okay, it also turns this leg this way. If I turn my lower leg in by putting my toes on the ground, okay, so my top foot is resting on my bottom foot, toes are against the floor, and it's not going to leave there, that's really going to help to shut that TFL down. Okay, so mainly with I should correct myself a little bit, mainly with the hips lower, that will shut down piriformis. With the feet turned in, that will shut down the TFL muscle, that front pocket muscle. The other thing I want to do, I don't want to be up here, I actually want to lay down flat. So that's going to take out my spinal muscles that try to take over as well. So I'm going to lay flat, I'm in this position. What I'm going to do, I'm going to squeeze my right glute. So I'm doing my right side. I'm going to open up that top leg, keeping my toe on the ground. I'm going to go just to where I can, whereas to the range of motion I have, that's comfortable, and go as far as I can. I'm going to hold it there for 4 seconds. I'm going to come down 1, 2, just to halfway. So I'm not letting that band go slack. I'm keeping it taut, keeping that tension in the band. I'm then going to push back up again. I'm going to hold it 1, 2, 3, and 4. I'm going to squeeze that glute as I'm doing so. Come back down for 2, 1, 2. I'm going to push it back up for 2. I'm going to hold it 1, 2, 3, 4. You're going to squeeze it real tight. Imagine you're trying to tear that band in half. Come back down for 2, hold it for 2, push back up, hold it 1, 2, 3, 4. Squeeze that glute, try and rip that band. Come back down. Again, guys, I'm not trying to go right back to the wall. I'm not trying to lift my leg off. I'm just going, you're just using the range of motion that you have. Okay, so strength is range of motion specific, so you can only be strong in the range of motion that you've got. If you're trying to go beyond the range of motion you've got, you're going to compensate. So just don't force anything, go to where you can, and that is it. So one more time, I'm going to push back up, I'm going to squeeze that glute. I'm going to hold it, 1, 2, 3, 4, and I'm going to come back down for 2. So there's some different tempo markings. The reason I'm doing the 4-second hold at the end is I'm really trying to get strong in that new range of motion. I've just opened up from doing all that mobility portion of this program. So I've opened all that up, and now I need to get strong in that range of motion. So I'm going to that new range of motion I've just got through doing these clams. I'm going to hold it there and really kind of, consolidate that strength and that new range of motion. So with range of motion, if you don't use your full range of motion, you will lose it, and you'll go to where it's the range of motion that you do use. So we want to be able to use our full range of motion. So once I've opened it up, I'm going to get strong in it. So that's why I'm going to do that 4-second hold. Okay. There's a couple of ways there's other things you can modify. You could hold for 2 if you really want to work on decelerating force. You can come back down 1, 2, 3, 4 and hold. So maybe if you're an athlete and if you do lots of jumping, so you're a basketball player, or if you're an athletic player, if you do athletics, if you do any kind of jump, like long jump, or if you do any kind of vertical jumping, again basketball, that sort of thing, or even football, we really want to work on controlling those forces as we come back down, so as we land, we don't fall into that knee bowing, or if you go to take a jump, we keep the knees tracking over the second toe. We don't kind of jump by dropping down and doing this first and then coming back up. We want to be able to keep everything aligned. So maybe if that's happening, if you're noticing that in your sport or your activities, maybe that's a sign we want to do that 4-second eccentric, that 4-second lowering, and really get that glute med to hold on and stabilize, that femur and that knee joint as we're loading up for that jump, or if we're landing, from an elevated position. So that might be a reason why we change it and we hold it for 2 and come down for 4. But for most of us, if we're trying to just correct our dysfunctions, we really want to work on that 4-second hold at the end there. Maybe we could progress onto the other one later. Now another modification, if we've done this, so we want to be doing anywhere from 12 to 20 repetitions. Okay. If this gets too easy, again, we can always make this stronger. We can always make this tougher by getting another band. But once we've gone through like the tough band, we can do 12 to 20 reps, no problem. We have to keep the stimulus, we have to have the required stimulus to get the adaptation we're looking for. If this was just too easy, if I was going, got to 12, wasn't really feeling anything, it's not the stimulus required necessary to get the adaptations I'm looking for. I can't expect any more further changes to occur. So I have to keep it progressive. Okay, so what I can do is, I might want to start with the band off. I can always bring it back on later. But I'm going to now increase the lever arm on my hip joint, on my glute max, by making my leg straight. Okay, so I've moved the center of mass from here to further down, and what I'm going to do, I'm going to drive my heel into the wall. Okay, keep my back against the wall here, same position, and now I'm going to slide my leg up the wall. This is actually a mirror behind me. It's not invisible. And then I'm going to come back down for 2. Again, I'm going to push my heel, squeeze my glute, drive that heel up, make sure my heel doesn't come away. I'm pushing it back into that wall. So it's going to get a bit more glute max work there. I'm going to hold it for 4 seconds, back down for 2, push it back up, hold it, 1, 2, 3, 4, come back down for 2, and drive it back up. Keep that whole leg locked out, make your leg dead straight, back down for 2. Again, I'm going to push it back up, going to hold it, going to squeeze it, push it into the wall, push that heel in, hold it, 3, 4, back down for 2. Okay, so that's how I can progress that clamshell exercise. I can also, of course, add the band to that as well. You guys might want to, depending on the surface you're using, I find putting like a hand towel or a little duster behind your heel helps to help the glide up the wall. So you're not going to, if it's like a rough surface, you're not going to like bumping up the wall. It's nice and smooth. So maybe that's what you want to try, and that can also act as a cue to push that heel in so you don't lose that towel, it doesn't fall out. So you are really working on pushing that whole leg, getting that hip extension going on. And again, if we get all that going on, that's going to further shut down that TFL, so we're getting pure glute work on that one. Okay, so that's for our gluteus medius, that's our clamshell and our sideline leg raise exercise. Okay guys, so we just did our gluteus medius activation. That was those clamshells, sideline leg raise. What I'm going to do now is show you the glute max, so our primary hip extensor, and we're going to get that one fired up. That's the big daddy that we need to get moving, get that one fired up. So I'm going to show you how to do that one next. So there's a couple of things we have to be careful. I do see glute max work being done, but not being done particularly well. I think we end up causing more harm than good sometimes of how I've seen it done. So this is what I see a lot of, and these are the problems that come with it, and I kind of mentioned it a bit earlier. So you see a lot of glute work done like this, with the knee bent and pushing the leg right up high. And what's the first thing we notice? Well, we get that big anterior pelvic tilt going on again, okay, which again is what we're trying to get away from. We're trying to get away from that. If I'm just doing this, reaching up, and again, remember what I said, we did the stretches, we've only got about 10 degrees roughly of hip extension. This is way more than 10 degrees. So again, if I go beyond that, I then have to compensate elsewhere, which is going to be at my pelvis and spine to make up for that. So let's just not do that. Let's just use the physiological range of motion that we have. Okay. The other thing is, well, with the knees bent, that's going to really favor our hamstring. So that bicep femoris is going to really ramp up in that position. I'm going to get the lower back muscles. I'm going to get the hamstrings fired up. I'm not going to get that much glute work. I'm just kind of, again, just making it worse, just kind of going around in circles. So what I need to do, okay, is I'm going to lay on my front, and I need to get those other muscles out. So if I'm going to get those lower back muscles and lat muscles out, I'm going to lay flat in this position, and I'm going to gently pull my belly button in towards my spine. Okay, so that will inhibit those muscles. If I'm going to get out my hamstrings so they don't get involved, I'm going to extend and lock out my knees. Okay, so where the hip flexors bend, they flex or bend the knee. If I extend it, that will shut those down. I've also actually brought my legs apart a bit because that will also shut down that adductor magnus muscle. So I'm going to shut that down. And all I'm going to do is, in that position, keep everything where it should be. I'm going to make this leg, I'm going to do my right side, keep my right leg straight. And I'm just going to try and lift that thigh off the ground, and that's all I'm going to do. I'm not going very high. I'm going using the range of motion that I have. I'm not extending my spine. I'm not bending my knee. I'm going to hold it for 4 seconds. I'm going to come back down. I'm going to raise it back up. I'm going to hold it 1, 2, 3, 4. I'm going to come back down. I'm going to bring it back up. I'm going to squeeze that glute. Keep that knee locked out. Keep my belly button pulled in. Hold it. 3, 4. Back down. Raise it back up. I'm going to hold it 1, 2, 3, 4. Let's show you guys one more. Straight back up. Keep that leg straight. Hold it. 1, 2, 3, 4. Okay, so again, I'm only using that 10 degrees or so range of motion I've got. I'm drawing my belly button in. That's going to help keep my spine neutral. I'm not getting that excessive lumbar curve, so I'm not ramping up those spinal muscles anymore. I'm not bending my knee. I'm not getting my hamstring involved. That's all staying out. I've got my legs apart or abducted. It's going to shut down that adductor magnus. So that's all I'm doing. That's all I'm doing right there. Okay, I'm just keeping all that stuff calm down, not doing anything. I'm just getting that pure glute work. Okay. I could also add a band to that. I could put a band around just above my knees and go straight into that. I could start in that kind of clamshell position or leg straight position, that sideline leg raise, rather straightforward, straight into that glute max position. And I can just rock and roll through those, get one done straight after the other. But again, when we're doing these activations, we have to be real careful that we are getting out those other muscles, that they aren't contributing. Again, if I'm doing like the glute max, I'm not bending that knee, I'm not arching that back, and I'm not going around in circles, I'm not just undoing all the work I just did, I'm just getting pure, in this case, pure glute work. And that's what's really going to make a difference. Get us strong and get those muscles switched on. So then when we go to reassess, we should see a difference. We should see less anterior pelvic tilt now. We should see less knees bow in or knees bow out. Again, with that asymmetrical weight shift, which I spoke about before, again, you would do this on the side of the shift. So if you was going to the left, you're only going to activate that left side. Okay, so that's what we have to kind of bear in mind. That's what we have to consider. Okay, next up, I'm going to show you guys some more core work, some deep core stabilizers. That's our transverse abdominis. I'm going to show you how to get that switched on, and we can also integrate that with glutes as well. I'm going to show you guys how you can do that, so we can start really building all these things together. And then at the end, we're going to do our integration portion at the end, our full body integration, where we kind of tie everything up together, and that's what's really going to make that big change to your posture. And also, if you're an athlete, if you're in sport or performance, it should hopefully really give you guys an edge, give you an improvement in performance too. So that's what's coming up next. So we've done our glute max. Hope you guys enjoyed that part. Leave a comment or send me an email, ideally at danbryanfitness.gmail.com rather. So that's glute max, and then next up, we're going to look at the TBA with deep core activation next.